Good evening and welcome to the happenings in Medfield. As a special guest, yes. As a friend, yes. As a gentleman that has been sitting here at the anchor desk many, many times for two factors. Number one, to advise the elderly on Medicare and all the other extremes, and as service officer. Ron Griffin. You know, Ron has been a guest many times as a Shine counselor, and now is also the town Veterans Service Officer, and now is open enrollment for Medicare. So we like to devote today's show to discuss Medicare. Well, Ron, it's Medicare open enrollment, and we seniors have until the 7th of December to choose our Medicare coverage for 2014. My first question is, what happens if we do nothing?
Well, Jack, if you do nothing, you'll end up with the same choices that you had this year. So doing nothing means re-upping for the existing plans that you have. Now, each year I usually have some cautions about that because some plans are discontinued. And so if they're discontinued, if you do nothing, you can't continue on to that plan because it doesn't exist anymore. But this year, no plans are being discontinued for healthcare. And for prescription drugs, there's only two companies involved. There's a Humana Complete members. They have a prescription drug plan that is being phased out, but they are rolling over their members into the Humana Enhanced plan, so there's really no change for them. And there's the Envision RX Gold plan, and now that is terminating. So those seniors, if they have Envision RX Gold, they'll be discontinued, so they have to select a new plan for next year. Now there's two Envision RX plans. One is the Gold, that is being discontinued, and the Silver is not being discontinued. That continues on, so don't confuse the two. So only those seniors with the Envision RX Gold are the only ones this year that won't be automatically renewed into their existing policy. So that's good.
Well, with the Affordable Care Act and the government shutdown, I'm really worried about health care and its future.
Well, and you're not alone. And there's a whole lot of people that are under age 65 that plenty is changing for them. However, as Shine counselors, we don't focus on those under 65 without Medicare. And what the plan is that they're going to have navigators that are going to guide people through the new Affordable Care Act plans. And I don't know where these navigators are going to be, but each state is going to have them. And what I do is I refer the seniors, or I refer to people here to the Massachusetts website, the Health Connector website, and that's the www.mahealthconnector.org. And there's an enrollment process that does work because it's been there for many years. And I guess my only comment about the health care is that, we're not in our first year in Medicare. And there's always plenty of information that we have to disseminate each year to folks. There's always plenty of folks that are still confused about Medicare. And we've been doing it since 1964, I think. So, that it's a lot of confusion for people that are under 65, I think comes at no surprise. There's a lot of things to be uncovered yet.
Well, so all this confusion really does not impact Medicare seniors.
Correct. The Affordable Care Act really changes very little for seniors, and most of those changes have already happened. So now, there's going to be cases where seniors are going to be called on the phone, or they might get some mailing or see some TV things that are going to pose threats to them, or saying you need to do this because of Obamacare or the Affordable Care Act, and they need to respond. Most of these are going to be schemes. And I do want to caution everybody, and this is also goes with the Veteran Service Group, you know, government agencies, they don't call you on the phone. So if you get a phone call from someone and they are proposing that they're from some government agency or communicating some government thing, you need to get suspicious really quick, because these folks, nobody gets a call from a government official, an agency. They send letters, is how you get notified when they want you to know something. They never call anybody direct.
So, Ron, you're saying nothing is changing for Medicare.
Well, I didn't quite mean to say that. There are little changes have to do with the Affordable Care Act. There are some changes that occur in Medicare every year. And this year they're very, very small. So let's go over a few of them. Those on traditional Medicare, every once in a while they get a Medicare summary notice in the mail that tells them about all the claims that they've made and how they've been paid and so forth. Well, they reformatted that claim so it's easier to read. You know, seniors bring those into me. We sit down, we try to read them, and they're really not user-friendly. Maybe user-friendly over 20 years ago, but not user-friendly as of today. The second thing is that those with Medicare Advantage plans, they never got any statements about their care and what was services they received and how they were paid for or what they cost or anything. So for the first time, they're going to be getting EOBs, which are explanation of benefits, statements that tell them, what doctors they've seen, what the company has paid for their medical care. And the last thing that's different is an outpatient mental health care. In the past, Medicare only paid 65% of that cost. And now, beginning in 2014, they're going to pay 80% of the cost, which is consistent with all other health care that traditional Medicare pays for. It's usually 80%. So this is now more consistent with that for people that have to have mental health doctor services.
Well, Ron, that's not very much change. I guess I was expecting more with all the media blitzes on the subject.
And the rest of the changes, there are more changes, and those really have to do with the independent policies. So each year, companies change their policies, regardless of what laws or what blitz is in the news. They have a lot of change, and perhaps that's the most important thing to note, is that the federal government, mostly Medicare is comprised of individual companies. And those individual companies, while regulated by Medicare and the federal government and the state government, they have a lot that they change every year. So we have to turn our focus to those independent policies, because it's not really the government policies that are making much change, it's the individual policies.
Okay, now let us start with Medicare Supplement Plan.
Okay, just a quick review on what Medicare Supplement Plans are. They're sometimes called wraparound plans, but they're most often referred to as Medigap plans. Now, Medigap plans are secondary pays to Medicare A and B, and they're private insurers. Now, Medicare pays for some services at 100%, but not all services. As we just talked about, usually it's about 80% that Medicare pays. These Medigap policies then, what they do is they cover that 20% of the bill. So as an example, if you go to the doctor and the doctor's visit, he wants to charge you $200 for that. The bill is sent to Medicare. Medicare does price control, and they'll just say, doctor, you can only charge $100 for this. So the doctor's bill is immediately dropped down to $100, and then Medicare says, okay, and we'll pay 80% of that. So they send the doctor a check for $80, and now there's $20 that's still outstanding that the doctor has to be paid for. Now that can come out of your pocket, or you could have bought this Medigap policy, and that $20 would have been paid by them. So, and it's important to know that, you know, there was in my example, there was a $100 write-off that the doctor had to take. Now he can't go after you for that. Okay, in Medicare world, there's no such thing as balanced billing. So whatever Medicare says is the bill, well, that's the bill. And in this case, if that senior had the Medigap coverage, they pay nothing for that office visit.
This sounds like a good idea, but who sells this type of plan and how costly are they?
In Massachusetts, there are 7 companies that are licensed to sell the supplemental insurance or Medigap plans to the public. Now, certainly we've watched TV, and we probably know about 2 of those plans because they're on TV a lot, and that's AARP and Humana. But other companies include Blue Cross Blue Shield, Fallon, Harvard Pilgrim, Health New England, and Tufts. Now, each of the companies offers 2 policies. They offer a Supplement 1 policy and a Core policy. Now this year, Blue Cross Blue Shield is offering the lowest premium for both policies, for the Core and for the Supplement 1 policies. Now, each company, these are regulated by the government and then further regulated by the state of Massachusetts. The policies offered by all companies are identical. So when I want to shop, I'm saying if I'm getting an identical product, why would I not want to pay the lowest price? So the policies are the same, and so I encourage folks to compare their policy and look at the premium and say, perhaps I want to go with the lower premium because I'm not giving up any coverage.
Can you just tell us again what the difference is between Supplement 1 and Core?
Certainly. So Supplement 1 plays all the balance on all Medicare approved claims. So the senior really never pays any medical bills. Okay, the bill is always 0. Medicare pays some portion of it, usually 80%. The Supplement 1 plan pays the additional 20%. The senior pays nothing. On the Core plan, the Core plan doesn't pay everything. So in particular, what it doesn't pay is there's a $1,184 copay for day 1 when you're admitted in the hospital. Well, they're not going to pay that. There is $148 a day after day 21 in a skilled nursing facility, a rehab facility. They're not going to pay that. And every year there is a Medicare Part B deductible. It's usually $147. It's $147 next year. They don't pay that. But they do pay, in my example, we talked about the doctor's bill. They do pay the 20% of the doctor's bill. So they pay a lot. And the difference is, and I'm going to give you the Blue Cross Blue Shield rates, The difference is that Blue Cross Blue Shield for the Supplement 1 plan is $175.10 a month. And for the core plan, it's almost half of that at $92.64. So maybe you're not paying it in co-pays, but you're certainly going to pay some money in premiums because they're not really cheap policies.
So no Medigap changes for 2014 except for the premium changes.
Correct. There's the only caution that I want to mention to seniors is on a Medigap plan, you have to initiate enrollment and you have to initiate disenrollment. There's absolutely no value of being doubly enrolled and paying 2 premiums. You're only going to collect from one of them. So some seniors forget to disenroll from a plan. So if you're going to enroll in a new plan, don't forget to de-enroll in the old plan.
Okay, let's move on. How about prescription drug plans?
Well, in prescription drug plan, this is always the most difficult choice for seniors each year. There's really only one intelligent way to choose a Medicare Part D plan, and unfortunately, very few seniors use it. There are 33 Medicare Part D plans this year. Now, that's up from 30 last year. So one plan is being discontinued that we already talked about, and so there are 4 new plans. Not only do their monthly premiums change each year, but the drugs that they cover also change, and the co-pays for those drugs change. So, and then there's a deductible. Some plans have a $0 deductible. Some plans have as much as a $310 deductible. Now, all of this confusion and change really makes it almost impossible to compare one plan against the next without help. Now, a lot of seniors, they look at the monthly premium and they say, oh, I want to go with a lower monthly premium. Or, you know, they're already like a certain company, they've been with a company, so they have a company that they want to continue to work with. Now, both of those choices or reasons won't get down to the nuts and bolts or dollars and cents of what each policy is going to cost you. So in order to do that, what you'd have to do is you'd have to take your prescription drugs that you take and compare the cost for all 33 plans. Now, there's a program that Medicare offers that does just that, and that really is the best way to choose a plan. So it's an online program, and essentially the program asks the senior what drugs they take, and then calculates the yearly cost for all 33 plans. When you're admitted in the hospital, well, they're not going to pay that. There is $148 a day after day 21 in a skilled nursing facility, a rehab facility. They're not going to pay that. And every year there is a Medicare Part B deductible. It's usually $147. It's $147 next year. They don't pay that. But they do pay, in my example, we talked about the doctor's bill, they do pay the 20% of the doctor's bill. So they pay a lot. And the difference is, and I'm going to give you the Blue Cross Blue Shield rates, the difference is that Blue Cross Blue Shield for the Supplement 1 plan is $175.10 a month. And for the core plan, it's almost half of that at $92.64. So maybe you're not paying it in co-pays, but you're certainly going to pay some money in premiums because they're not really cheap policies.
So no Medigap changes for 2014 except for the premium changes.
Correct. There's the only caution that I want to mention to seniors is on a Medigap plan, you have to initiate enrollment and you have to initiate disenrollment. There's absolutely no value of being doubly enrolled and paying 2 premiums. You're only going to collect from one of them. So some seniors forget to disenroll from a plan. So if you're going to enroll in a new plan, don't forget to de-enroll in the old plan.
Okay, let's move on. How about prescription drug plans?
Well, in prescription drug plan, this is always the most difficult choice for seniors each year. There's really only one intelligent way to choose a Medicare Part D plan, and unfortunately very few seniors use it. There are 33 Medicare Part D plans this year. Now that's up from 30 last year. So one plan is being discontinued that we already talked about, and so there are 4 new plans. Not only do their monthly premiums change each year, but the drugs that they cover also change, and the co-pays for those drugs change. So, and then there's a deductible. Some plans have a $0 deductible. Some plans have as much as a $310 deductible. Now, all of this confusion and change really makes it almost impossible to compare one plan against the next without help. Now, a lot of seniors, they look at the monthly premium and they say, oh, I want to go with a lower monthly premium. Or, you know, they're already like a certain company, they've been with a company, so they have a company that they want to continue to work with. Now, both of those choices or reasons won't get down to the nuts and bolts or dollars and cents of what each policy is going to cost you. So in order to do that, what you'd have to do is you'd have to take your prescription drugs that you take and compare the cost for all 33 plans. Now there's a program that Medicare offers that does just that, and that really is the best way to choose a plan. So it's an online program, and essentially the program asks the senior what drugs they take, and then calculates the yearly cost for all 33 plans. And it sorts the results into a list with the cheapest one being first. And then you can view further details. In fact, you can even get a month-by-month view of the cost. And it really is predicting, based on your drugs, your total yearly cost for next year. And it's a good thing. And it also, if you want to save some money by doing mail order, it'll tell you what the same thing would cost for the same company if you did their mail order, because usually there's a savings there as well.
Well, Ron, that sounds great, but as you know, I don't use a computer. So how does this help someone like me?
Well, that's the challenge. There are many that will help. First, however, the senior must carefully prepare a list of all the drugs that they take. They need to spell it accurately because most of that help is going to come from non-medical professionals. If I were to help you, I don't know the names of these drugs. They mean nothing to me. So you have to make sure you spell the name correctly. You have to put down the dosage that you take, because we want to get the right pill. If it's 40 milligrams, we don't want you to fill it with 80 milligram pills. And then we need to know how often you take those pills. Whether you're going to need, if you take them once a day, you only need 30 pills a month. If you take them twice a day, you're going to need 60 pills a month. And of course, that's going to cost more. So that is the first thing that all the seniors must do, is prepare that list. Then it's a question of where can you get somebody to do the search for you. Now, you can call Medicare, and that's 1-800-MEDICARE, and it'll take some time over the phone, and you understand there'll be millions of others calling in. So you can call them, they'll help you. And I suggest that you call in when most of the country's sleeping. So either we're on the East Coast, so if you get up early in the morning, you know, you're not competing with the folks on the West Coast trying to get the same information. If you happen to be a person that stays up late at night, call late at night, you'll be on hold a lot less time. Also, there's the College of Pharmacy and Health Services in Worcester. Now, it's a college for pharmacists, and they help seniors, and they have a number. It's 866-633-1617. Now, because it's a school, they're only there doing school days, Monday through Friday, from about 8:30 to 5, I think. And but they're all pharmacists in training, so they're really knowledgeable folks. In fact, I think seniors should remember that number, because if they have a drug-related question that they might have even later on in the year, you call that group and they'll tell you, oh, something about that drug, or answer your question. They're very knowledgeable about the drugs. And another area is you might get a relative or a friend, a son or a daughter, or even a grandchild that is knowledgeable about computers. It's really a simple site to operate, so they will be able to use the computer and get that information out. Lastly, maybe not lastly, but Shine. We also Shine. We help out by taking and mailing back a request. We don't do it over the phone, because we're all volunteers that platoon from time to time, so there are no times of the day that we can say the phones are being manned. So we do it by mail, do what we can, and mail it back to the folks.
You know, you didn't mention yourself, Ron. Don't you also do this for our seniors?
No, I usually don't, Jack. And the process is fairly complex, and it certainly is time consuming. So other Shine counselors, and I volunteer through the HESCO office in Sharon, and that's where the other Shine counselors are. And over time, they do thousands of these every year, and they get really good at it. They get really to know the drug names. They know all the pitfalls that people run into, because they've already run into them. They've been doing it for a number of years now. So it's best that I let them do it, and we do the mail order, and then that frees me up to be one-on-one with seniors and answer their questions instead of and doing the drug search. And it simply isn't enough time. If the drug search would take, I'd have to have 2-hour appointments with people, and you know, that's not going to work out. So I do 45-minute appointments, and you know, try to even wrap up in that 45 minutes is difficult. So what happens is at the senior center, I have first I have a sheet that tells seniors how to do it yourself, step by step. Get onto the Medicare website and what screens were going to come up and how to answer those screens and provide the information. And then I have another handout that is a mail-in application. One side of the application, you fill in information about yourself, your name and your address, what kind of insurance you currently have, and then on the back side you list all your drugs. You take that and you mail it in to HESCO, and then the volunteers will work that list, and hopefully within about 7 to 10 days they'll send you back the results. And because it takes 7 or 10 days to do it, we're working through the mail, which slows things down a little bit. You really have to go to the senior center, get this application. You got to get it mailed in by the end of November, or there just simply isn't going to be time to get the results back to you.
You know, Ron, this all sounds a little too complicated. Is it worth it?
It usually is. So when often seniors will save about $1,000 a year in the prescription drugs by doing this. So if you haven't done it before, do it again. Because there's so many changes each year, I recommend that everybody do it again. It is labor intensive, it is time consuming for everybody, even the volunteers, but it does save the seniors money very often.
So I do all this and want to change plans. What do I have to do?
All right, once you've decided on a new Medicare Part D prescription drug plan, there are several ways to enroll. So I recommend that you call Medicare at 1-800-MEDICARE. And at the end of the conversation, they're going to give you a control number. Because you've dealt with Medicare, it's over and done with. So you now have proof that you did this control number they give you, a reference number, is going to be the proof that you did it. So if anything goes wrong, it's Medicare's fault, and Medicare will fix it. You can also enroll online through Medicare.gov. And again, you will also get a control number, and Medicare is responsible for that enrollment. I don't recommend the other processes because they involve other people. And I've seen too many lost enrollments. You know, and you won't know your enrollment's lost until it's too late to enroll, and then you'll never find the person who's responsible, and they can't, and even if you do, they couldn't fix it anyway.
Well, if I were to enroll, say today, and then next week I get my Shine report recommending another plan, what can I do?
Well, you call Medicare again, and you'll enroll in the plan that perhaps Shine recommended. Now, there is never a reason to cancel enrollment in a Medicare D plan. Every new enrollment cancels out the previous enrollment. So only the last enrollment of record will ever count. So just call again and re-enroll. And by doing that, what you did this week will be canceled.
Well, Ron, I know that there are other Medicare choices to talk about. Can we move on to them now?
Yeah, the last group that we want to talk about is the Medicare plans, is the Medicare Advantage plans. We've already mentioned them a couple of times today. Few seniors understand the difference between a Medicare Advantage plans and Medigap plans. And that's because they're both sold by the same companies. Typically, the companies are Fallon, Blue Cross Blue Shield, AARP, Humana, and Harvard Pilgrim. So both these companies sell both types of policies. Now, I like to leave the Medicare Advantage discussion until the last. And that's because what I have to do is I have to prefix that by saying, forget everything else I've talked about, because it doesn't apply anymore. So this is like a new conversation that we're going to have about a new policy. So that's what I'm going to say. Let's forget what I already said for the past 20 minutes.
Okay, Ron. I'll try, but this is always confusing to me as well, even after doing this type of a show with you for many years. Well, let's get to it.
Okay, my first point is to understand that Medicare Advantage plans are alternative health care plans from the Medicare that is offered through the federal government. So instead of paying medical providers, Medicare will now pay insurance providers. And those insurance providers will pay the medical providers. So essentially what we have here is subsidized health care. Now, many of the seniors believe that they still have Medicare A and B because they have a card that says so. And they know that they're still paying that Medicare Part B premium every month. So of course they have it, but they don't. They no longer have Medicare A and B, and that any claims to Medicare to pay A and B, under A and B, they'll all be denied. So if they select the Medicare Advantage plan, they need to use the ID that the Medicare Advantage plan gives them, because that's the only one that's active. And then they need to take their Medicare ID card and they need to put it in a drawer somewhere because it's useless. It's only going to cause confusion if you try to get it out. And you don't have Medicare anymore. But do leave it in a safe place, because maybe next year you'll decide to go back to the Medicare, traditional Medicare A and B, and give up your Medicare Advantage plan, which you can do every year through open enrollment.
So I am trading my Medicare Part A and B coverage for Medicare Advantage?
That's correct. You're trading in your A and your B to get the Medicare Advantage plan. Now, Medicare and the state of Massachusetts still regulate these Medicare Advantage plans, so they're well regulated. But all your health care is all your health care is going to be provided through that Medicare Advantage plan. And the coverage in that plan is not determined by Medicare, it is determined by the little policy handbook that they're going to give you. So they give you a big handbook, and everything you want to know about your medical care is in that handbook. It's not in the Medicare manual, it's in that Medicare Advantage handbook.
Are there many of these Medicare Advantage plans?
There's 21 of them this year. So, and all of them are either an HMO or a PPO. So that's how they kind of stick out from the rest. So Harvard Pilgrim is returning to the marketplace this year. They're offering an HMO. They've been missing from the marketplace. So that's what another thing that's new this year is there is a new policy to look at.
Can you explain the difference between HMO and PPO plans?
Yes, an HMO plan is a restricted plan. You get your health care services through in-network providers, and it often requires referrals through your primary physician. So if you go out of the network, except for emergencies, you'd end up paying the entire bill. Where a PPO is a little bit of a combination of both. They have networks, and if you stay in the network, they pay most of the bill. If you go outside of the network, they usually still pay the bill. However, your copay is usually increased. For instance, if you're in network, you might go to a doctor and the copay may be $20. And if you go to a doctor that's out of network, your copay may be $40.
Well, how does one choose one of the 20 Medicare plans? Is there a computer program for that as well?
No, there's no program. So the decision is really very difficult to make. Unlike prescription drugs, we can predict what our prescription drugs needs are going to be for the upcoming year. But we really can't predict how many times we're going to get sick, or how many times we're going to go in the hospital or need a CAT scan or an X-ray. We can't predict that kind of stuff. So we really can't know what each plan's going to cost us until the end of the year. So my recommendation for folks in choosing one of these Medicare Advantage plans is that they talk to the doctor. Because if your doctor's not in the plan and doesn't accept it, possibly that's good reason to avoid that plan. Because otherwise you might have to change the doctor, and a lot of people don't want to do that. So if the doctor doesn't participate in a certain plan, that plan probably should be eliminated. My second recommendation is that the seniors go to one of the sales meetings that all of the companies offer at this time of the year. Now, I've been to many of those sales presentations. I am very impressed. They're usually well delivered, very professionally done, and very fair, very fair. And they provide very accurate and up-to-date information. They work for the company, so that they answer all the seniors' questions, or they get the answers if they didn't have them right there. Now, the downside is that if you're going to a tough sales meeting, they're not going to tell you about the Blue Cross Blue Shield plan, okay? You know, they're not going to promote that, of course, and vice versa. So you have to go to several of these if you want to learn the difference between the plans. And the devil is always in the details. The devil is always in the details.
So you still need to know that Medicare Part D plan searches to figures out which Medicare Part D plan to enroll in.
Well, no, not so with Medicare Advantages. You don't do that Part D plan search. That's because when you get a Medicare Advantage plan, a Medicare Part D plan is embedded in that healthcare plan. It's part of that healthcare plan. You can't separate it. So because it's embedded, you get all your healthcare through that plan, you get your prescription drugs through that plan, and you have no choice about your prescription drug plan. So you don't have to do that misery of doing the plan search. So if you are enrolled in Medicare Advantage plan, and you want to stay in it, don't worry about the Medicare D search because your plan is providing that coverage.
Okay, so all Medicare Advantage plans have embedded Medicare Part D prescription drug plan.
Of course not. So they all don't have it. Some plans don't have an embedded prescription drug plan. So you have to be careful, because if you choose one of those plans, you won't have any prescription drug coverage for the upcoming year, and that could be disastrous.
Ron, why should anyone want a Medicare Advantage plan without prescription drug coverage?
I can think of two reasons. All right, the first reason is that the senior might be enrolled in the VA healthcare program and might get their prescription drugs through the VA, and they wouldn't need a Part D plan. The second reason is that there's a lot of seniors that don't take any prescription drugs, and they say, why do I need to buy something that I don't need? So they choose not to buy one because they don't use any prescription drugs. They're taking a risk because they'll probably get assessed a penalty later on when they do get ill and do take prescription drugs. But the plans must work because people still enroll in them, and if people didn't enroll in them, then I guess the companies would disband them. You know, they wouldn't keep them. So there's plenty of people enrolling in them.
Well, Ron, the old clock on the wall is telling me time to wrap it up, but there's a couple of questions I want to ask you. I've gone over this with you. You've answered. I think, this is my opinion, that as you have covered it, you mentioned getting you on the phone for an appointment to go over this. Because I feel, in some respects, to the average senior that sits down, it's going to be a little confusing. So I would say call Ron, Shine Counselor, at 508-359-3665. There's quite a bit to this. Ron is trying to make it as simple as possible, but it does get, in a lot of areas, probably very confusing to you. So remember, give Ron a call, set up an appointment, and sit with him, and he can go over in detail some of the areas we covered. Ron, I want to thank you very much.
All right, I just want to point out that, when you call the senior center, the 3665 number, you're not going to get me. You're going to get someone at the senior center, and that's where the appointment book is. For the rest of this year, I'm going to be there at least every Tuesday morning. So do call, make an appointment. I seldom do work on the phone. It's just too difficult to explain over the phone. But if I'm with you and I give some handouts, often I can make that explanation easier.
Well, Ron, in closing, is there anything else you'd like to add before we say goodnight?
That's it for me. Thank
Good.
you for having me.
It's always been a pleasure. Look forward to it. This is Jack Peterson wishing you and yours the very best. Good night.
This program was made possible through the generous support of your Medfield friends and neighbors, folks just like you. And thanks for watching.